Ladies and gentlemen, welcome to Pacific Bridge Medical's webcast on medical device reimbursement in Japan. Questions can be submitted during the presentation via the chat function on your screen. They will be answered at the conclusion of the presentation. I now introduce you to the President of Pacific Bridge Medical, Ames Gross. Mr. Gross, the floor is yours.
Hello, hi, this is Ames Gross from Pacific Bridge Medical, and thank you for attending our webcast today on device reimbursement in Japan. Just as a quick note, Pacific Bridge Medical is a consulting company. We help medical companies in the Asian marketplace with regulatory and business issues. So I'm going to start the presentation here on the next slide, which is a map of Japan. I think most people on the call are probably pretty familiar with Japan. Capital city is Tokyo. Population in Tokyo, maybe 10 to 12 million people. Overall population in the country, about 127 million people today. But in about 15 years, the population is going to go down to about 95 million people. And that's because in Japan, families are having less than one child per family. And as people know on the line here today, Japan's society is quickly aging. So once some of the older people in Japan die, then the population will decrease because there's not as many people being born into the society. Some overall healthcare facts. The market size of the device market size in Japan has held steady at about $25 billion over the last 4 or 5 years. In Japan, the government pays universal health insurance, and the employer contributes via payroll deduction on the taxes, and the patient also does copay in Japan for the universal insurance. As I mentioned, it's an old population getting older fast. And, the overall expenditures on healthcare for GDP in Japan is about 8%, when it's only about 15%, where it's as high as 15% in the United States. So Japan's healthcare expenditures versus the GDP, about 8%, whereas the U.S. is about 15%. People are familiar with the average hospital stay in Japan could be 30 days. If you have a baby, you're normally in the hospital for a week. If you're in the U.S., you have a baby, you're normally in the hospital for 2.5 days, depending if there's any complication. The government pays the health insurance, so they're very concerned about losing money, which they've been doing for many years. So they're trying to reduce reimbursements and reduce their spending on health care. And keep in mind that in Japan, it's a very different system than what we have in the United States. Up until the new health care legislation in the United States, we probably had, A or B plus health care for 250, 270 million people, with no health care for 50 million people. So we had an A system for most people and maybe an F system for the people who didn't have health care. So there was a wide variety of the kind of health care you could get to within the United States. Whereas in Japan, since the government is providing universal insurance, the government also in Japan tries to give the people in the country a basic level of health care. So I'd say like a B or B plus level of health care for everybody, but they may have less people that get A health care or less people that get an F health care, because as I mentioned, it's universal insurance for Japan. So what happens here sometimes is people have they claim they have the best widgets in sliced bread, but the question is, do the Japanese doctors and does the Japanese government want that product coming into Japan? Because if it's extending the life of older people and they have too many old people and the government's paying the insurance for those older people, the device might not get through the regulatory system. And so just because it sells here or Europe, whatever, doesn't mean it's going to work in Japan. And again, that's greatly because of the government health insurance system, which is giving a B level of health care to everybody, but not necessarily an A level and health care to everybody. Also, the Japanese system is extremely conservative. So in the past, if you had cancer in Japan and you were taking chemotherapy, the chemotherapy in Japan would be significantly less than what you could receive in the West, U.S. or Europe. And because the chemotherapy was a lot less than you could get in the West, it was normally a lot less successful. So, but that's sort of the Japanese government, the Japanese mentality, very conservative, very worried about people's deaths and products that cause problems. Next sheet, I think people are familiar with the MHLW, equivalent to the FDA here. The PMDA is the regulatory body under the MHLW. And then a couple other bureaus here would be the Health Insurance Bureau and the Health Policy Bureau. These are involved with the reimbursement scheme. They set the rates and the the reimbursement coverage. You have another group, which is an outside advisory board to the Health Insurance Bureau and the Health Policy Bureau called CHIKIO. And CHIKIO is crucial in the reimbursement process in Japan. Also in Japan, there'll be expert committees, basically specialist doctors that advise the PMDA or MHLW on certain products, registrations, etc. Now, this is a really messy map about the overall reimbursement system. But what I want you to do, keep in mind, is you have the payer, the government, Japanese government, the green on the top, and then the lighter blue, you have the insured person. And this goes through the flow chart of the reimbursement system. Keep in mind that in this system, the distributors and importers are separate businesses. So companies that can import may not be able to distribute. Companies that distribute may not be able to import. We'll get into this a little more as we go in the presentation. So basically, only the importer can submit a request for reimbursement, but the distributor cannot. So also, obviously people on the phone are aware of the MAH. The market authorization holder can either be your own entity in Japan, could be your distributor in Japan, or it could be an independent third-party MAH in Japan. And Pacific Ridge Medical now has its own MAH set up in its office in Tokyo. You can see on the top here the HIP, that's the hospital insurance points, and then the price per device is on the right top in orange. So the payment system for devices, this is pretty self-explanatory, but 70% of the product reimbursement is through the brand is capital equipment or fees for a medical procedure, the technical fees. So the medical procedures are covered in what they call technical fees in Japan. And some capital equipment is reimbursed on the brand name. Then 30% of the reimbursement for devices in Japan is through what they call special treatment materials, STMs. And for the special treatment materials, the pricing is set according to a functional category. Again, the price is set given a functional category. So let's go on and we'll learn a little more about that. So in the next slide here, you can see on STM, special treatment materials, that these are the functional categories. They only apply to the STMs and not to other reimbursement schemes. So basically, there's 160 major groupings in Japan. The clinical benefit is the basis for the functional category. So products are grouped according to similar functions. And what it does, though, is if it groups a number of product similar functions into the same functional category, there's each functional category then has increased price competition amongst the products in that functional category. And the upcoming slides, the prices are a little old, but they illustrate the general point we're trying to make with reimbursement in Japan today. So here we have an example of a dialyzer and the relationship between the functional category and the reimbursement price. So under the functional category, we have a number of different products that are in the functional category of dialyzers, and also you can see that the pricing on the right for the reimbursement, depending on the type of dialyzer, yeah, sorry about that, and the different products in that category, so you can see the amount of reimbursement. And so you can see the reimbursements are fairly similar, except for the last item, where you have the special laminate type. Now, one of the key things to keep in mind, besides the functional categories, is the allocation of hospital insurance points. So basically 1 point equals 10 yen, because hospital insurance points will be crucial to understanding the reimbursement system. So the HIP points are for technical fees, surgery fees, medication fees, injection fees, some of the other items mentioned here. And the medical device cost is going to be reflected in the hospital insurance points. And also, too, the drug costs, if you're looking at drugs, will be illustrated by the hospital insurance points as a purchasing price, too. So here we get to the thrust of the matter with regard to medical devices and reimbursement in Japan. And these are the categories that your product could be classified. Obviously for registration purposes, you have to get the product classified. It's a class 1, 2, 3, 4 product. Class 3 and 4, obviously on the registration, the higher risk devices, and the more difficult to get registered in Japan. But once your product is registered, whether it's a class 1 to 4 product, these are the reimbursement categories that the importer, or if the company has their own office, their own people in Japan, can try to choose to get the reimbursement. So obviously, category A1 is, but the cost of the category 1 for reimbursement is included in the technical fee or the procedure fee. For category A2, the product is used with specific technology. The cost of the device is not reimbursed, but included in the technical fee, and normally have the A2 classification for reimbursement with higher-end products like MRIs or CT. Class B would be, the category B would be the certain medical devices meets the definition specified by the MHLW, and basically these will be reimbursed fully or on a functional basis, normally based on the predicate. And for category B products, an existing technical fee is already present. So for that device, there's an existing technical fee already in place. So then if you have a product that's a little different, maybe a higher class classification or risk of class 3 or class 4 products, your products will normally end up being in reimbursement category C1 or C2. And so basically for C1, it's in the same product category as category B, but the device has a new function. And the technical fee is already set for C1 product. There's a technical fee that exists for the procedure, but you need a new functional category for C1 product. And then C2 products are similar to C1, except for in C2 product, you need to have both a new technical fee and a new functional category. So again, C1, you're just looking at a new functional category. Same product category as category B. C2, you need both a new technical fee, or the procedure fee, and a new functional category must be created. And then category F is basically for products that are so novel that they don't match any of the products in the reimbursement system. And so these are innovative products, innovative technology, and so these products are treated separately from the A to C categories, and really very few companies apply for category F. I'm not really aware of any that have, but that's the in the regulations that category F is definitely there. So we're going to give some examples here of the different reimbursement categories. And category 1, so here, it's a medical device that's widely used and not specified as a medical technology. So indication is not specific. And so here's some of the treatments on the left and some of the devices used to treat those problems. And again, an example of an A1 product is where the cost of the device itself is not reimbursed, but the reimbursement is based on the technical fees. Again, the cost of the individual device is not reimbursed on its own, but the reimbursement for the product based on the technical fees or the procedure allocation for that situation. Now, on page 13 here, we have an example of an A2 product. So here, the medical device is specified with medical technology. And again, though, is similar to A1, the product reimbursement is via the technical fees or the procedural fees. So here you can see on the chart below what the tests are and the devices used. And the HIP is the hospital insurance points allocated for these certain tests. And Other examples of products parity would be like a diagnostic X-ray, CT imaging product, endoscopy product, etc. So the product is reimbursed again via technical fees. Now we go to example B. You have a different situation. Instead of like the A products that were reimbursed through technical fees, in category B, the medical device is reimbursed based on the cost of the device, the cost of the individual device. And as I mentioned just earlier, normally this will be large equipment, MRIs, CT, etc. We have another example below, different types of dialyzers, and different prices allocated for the different dialyzers. So this is the example of B, and here we're not looking at the technical fee, we're looking at the cost of the device is fully reimbursed. Another example of B, again, the device is fully reimbursed at cost, and we're looking at the PTCA catheter. So, we have the different catheters on the left side here, what they do, what the price reimbursement is in Japan for each of these these catheter products. Again, category B, the cost of the device is fully reimbursed. We're not looking at the technical fee for category B, only for A so far. So here we have some general rules for reimbursement. Again, category A products do not receive an individual reimbursement price. The cost of the device is included in the technical fee. And just keep in mind that once you've allocated category A for your reimbursement price, or the government has, there's basically no way to negotiate with the government once your product categorized as a category A reimbursement price. So again, there's no way to negotiate with the government once the category A is defined for your product. As we mentioned in the last few slides, category P products have an individual reimbursement price. And in this case, the medical facility will get the cost of the device from the Japanese government. And on the category B products, the price is based on the clinical benefit of each device on its own. And if the device has increased clinical benefit, then they're going to get a higher price. So again, the price for category B products is based on the clinical benefit of each individual device, and devices that provide increased clinical benefit normally get a higher price reimbursement. Okay, here's some more information on category A2 and B products. So basically, newly approved medical devices which have the same clinical function, clinical indication, and shape will be categories A or B. So basically, the price of A and B reimbursements will be the same as other products that are existing that have similar functions and they're in the same functional category. Again, negotiation with the MHLW is not allowed, but in this situation, you can have a request for reimbursement listing, and if you do this, it will normally be reviewed by 3 different divisions, the insurance, economics, and review control of the MHLW. If the device corresponds to the definition of the functional category. So basically what happens is, if the Japanese government cannot confirm the equivalence of the requested device, or the new device being registered in Japan, to an existing A or B functional category, the reimbursement category will change to category C. So I'll say that again. If the Japanese government cannot confirm the equivalence of the new device you're trying to register in Japan to an existing functional category, the reimbursement category will change to category C. So the main thing is about products in category C is that they're going to have a new functional category as opposed to products in A and B. So what I did here in the next few slides, I put some of the required documents on the screen so you can see these documents. They're not scary documents. And just get a sense of the process for listing A and B products in Japan. So on the first page here, form number 1, just keep in mind that this information on form 1 must match the application document and that it is reviewed by the MHLW. So in other words, if you put the name different or you put the model number different or something here, you're going to have a problem on form 1 for reimbursement category A1. So we're looking at one page of information. You submit to the MHLW for the review. And I'd say normally around 20 or 25 days after receipt of the request, the MHLW will be able to get back to you with the reimbursement. Because remember, A1 products are pretty much commodity products. Now, if you're going for the application A2, there's a different form. And again, this form explains the functional category and the expected price by an applicant is described. Now keep in mind that if the medical device has multiple functions, the code of each function associated with the medical device needs to be included in the section of items, medical service, or remarks in the application. So again, if the medical device has multiple functions, the code of each function associated with the medical device needs to be included in the selection of remarks or comments at the end. Because keep in mind that each function of the medical device specifically defined in the JMDN, or the Japan Medical Device, JMDN, Japan Medical Device Nomenclature Code. And so for some medical devices, there are multiple Japan Medical Device Nomenclature codes. So again, if the product has different functions, you can get different reimbursement codes. Now here's an illustration of Form 2 for Category A2 product. And keep in mind, again, if the names of the model numbers vary, you're going to have a problem. And on the A2 application, the MHLW confirms the equivalency of the new device with an existing already approved device based on all the descriptions included in the initial application, such as the structure of the device, the shape, performance, the use, the patients that are targeted for your device, etc. And the MHLW for the A2 products also confirms whether the descriptions in your application for the registration or descriptions for the application for the reimbursement match the definition of a functional category for reimbursement. Okay, so here the MHLW then confirms the equivalency of the new device with an existing already approved device based on the description of the product. And the MHLW will also confirm whether these descriptions match the definition of the functional category for reimbursement. So this is, again, the application form for Form B. So again, the first page describes the device on page 21. And the difference from the A2 is that the functional code is described in the upper table. So you can see that there here on the product code on the yellow on the top right. So the difference from the A2 reimbursement code is that the functional code is described in the upper table. This is some more of the attachments for application B. So basically, reference pages of the regulatory application need to be referenced or specified in each of these columns here. And also, you need to put in the expected patient population of targeted diseases should also be estimated. So this is some more information on Form B. So again, the content of the product registration application document must match the definition of the functional category, especially for performance and function. So again, the content of the product registration application document must match the definition of the functional category, especially for performance and function. And you can see here on the middle column, and also it must be explained that the device does not meet the definition of functional category that would go there. The shape doesn't meet the situation there. Now, the process for reimbursement A1, A2, and B listings, again, these are well-established categories. These are more toward commodity or Me Too devices. And obviously, you can see at the top, you have to get the regulatory approval. Normally, you can get the reimbursement for these products within 4 to 6 months. And these are some of the steps here you need to take. Obviously, the MHLW is going to agree or disagree with the foreign medical device manufacturer, whether they think the reimbursement is appropriate. And again, here for A1 products, approval 20 days after receiving the request. We've normally seen that to go more like 30 days. And for A2 products, A2 and B products, they'll normally be reimbursed from the first of the month. But this can be tricky too, and there can be some delays here even for these commodity or Me Too products. So when you or your office in Japan or your distributor in Japan starts to prepare the documents for the reimbursement, you can see the forms aren't so complicated. And as I mentioned before, the Japanese medical device nomenclature and the general name, which is described in the application document, must match the definition of the functional category published, especially for category B and C1, which we haven't started yet. And the clinical benefit is the basis for the functional category of the medical device. Again, the clinical benefit is the basis for the functional category of the medical device. So if there's going to be a new functional category, as I mentioned, that's going to turn us into reimbursement category C. And that's what we have here on the next page. So you can see on category C1, the technical fee has already been established. There's no change on the technical fee, but it is necessary to develop a new functional category. So if it was in the same functional category, it would go in product A or B. But since we have to develop a new functional category, the category code is C1. So, when you're applying for C1, it may take longer. It's going to take longer to get the new functional category set up. So some companies will agree and accept a provisional price, which is the same price of the device having the most similar function. So the device can be tentatively approved. The reimbursement of the device can be tentatively approved according to a provincial price. And basically the provincial price is the interim price that is temporarily used and determined based on the existing price. So companies that are sort of eager to get their products on the market and they want to get on as soon as they can, and while they're waiting for hopefully a higher reimbursement C1 category and for their new functional category to be set up, they may go with the provincial price just to get on the market sooner. But keep in mind that some foreign medical device companies also choose not to sell or list their product at these so-called provisional prices. Since if you're selling your products in Japan at the provincial reimbursement, provisional reimbursement price or the temporary reimbursement price, it can make the situation unprofitable for the company. So there's no real reason to sell at a provisional price in the interim. So some of these companies that choose not to sell their or list their product at provisional prices will wait longer to get in the market, on the Japanese market, but they're going to hope for a higher price because they're in the C1 category. So again, the reimbursement price must be decided based on the function of a device. The applicant has to address clinical benefits, features, and benefits. So that if there's no comparable device is available on the market, then the product is normally going to the C1 category. And again, if the foreign medical device applicant does not accept the provisional price and wants to get the higher reimbursement to start off in Japan, the foreign device company must also submit the cost structure of the product, which includes things like the standard cost, sales promotion, etc. And obviously, to get the C1 new functional category and for the MHLW to analyze the cost situation of your product, it's going to take a lot more time to get reimbursement, but hopefully you're going to get a higher reimbursement than you could before. So here we go through some information on setting up a new functional category. So you're looking at the comparison of the price of functional categories of the devices, calculation method, your added values to the price of similar devices, and then hopefully you're looking for the price adjustment. And you're trying to look at comparisons with the price of the similar device in foreign countries. Now we'll get into this FRP, foreign reference pricing, a little later in the presentation. But here, we're setting up a new functional category. So these are the reasons that you can try to go for a new functional category. It's a new mechanism which provides increased clinical benefit, usefulness, and other products on the market. It's safer, improved medical cure, safe to medical professions during the procedures. If the product improves the medical treatment of the targeted injury or cure of the target disease, it's going to have a new functional category. If the product improves the medical treatment of the targeted injury or cures the disease, then it'll go into the C1 category. Also, the C1 product category is another way to get the new functional categories if there's a smaller impact to the environment from the waste after usage of the device compared to the waste from the usage of other existing technologies that you're competing with. That can also help you get into a new functional category. So here on the required documents for Category C, I did not include the necessary forms for Category C reimbursement, but the forms are basically more detailed and complicated than the A or B forms that I showed you previously in this presentation. And then these are some of the attachments that need to be attached for the C1 or C2 actually reimbursements. So now we're going to look at the reimbursement code for C2. And so like C1 code, the C2 category, there'll be a new functional category, like C1 products, but in C2, there's also going to be a new technical fee. So remember, in C1, we had a new functional category, but the same technical fee. In the C2 categories, there's a new technical fee. So that's the difference between C1 and C2. So, really, once the MHLW and the expert panel agreed to apply for the C2 category, then the MHLW and expert panel will normally determine the new technical fee for this new device. And so if the MHLW and the expert panel agree that C2 is the appropriate category, and then the MHLW and the expert panel will settle on the new technical fee for Category C2 reimbursement. And then for Category C2, again, similar to C1, in January, April, July, and October every year, the newly requested devices will be reimbursed with the new settled functional category and price. So there's basically 4 times a year when you can apply for the C1, C2 reimbursements. So we do have a couple slides here for C1, C2 reimbursement. So actually, I guess I do have them in here. So we can flip through these fairly quickly. And you can see here's the request for C1 to C2 when the similar category is present. Again, when there's request for reimbursement listing, when there's no similar categories present. So basically the information is the same as the previous page, but the positioning is different because no similar function on this product reimbursement application. So this page explains the description of the device, such as the purpose of use, the form, structure, raw materials, or composition, and the method of use. So these are the items to help identify the device. and the reference must be specified in each column. So here's where we get a little more detailed. This is the same information for A2, but it also includes more detail. Again, so here's a document from the C1 reimbursement form 2.1, and so it's pretty self-explanatory here, I think. Then on Form 2.2 explains the background information why an applicant thinks the requested device does not match an existing selected functional category like its products A or B, and how the product doesn't match the selected predicate. So here again on this slide here, Form 2.3, you have to explain why the existing functional categories are not going to work for your device. And keep in mind here on Form 3.1, all of these explanations should be science or evidence-based and should be matched to the regulatory application documents. So here on the ground for value, innovative products, whatever, you should base your information on science evidence, which matches the same information you had in your regulatory application document. So Form 3.3 is the ground of marketability. If it is not designated as an orphan device, you need to estimate the patient population for your product and the procedure. And Form 4 here contains some more information on the raw material costs, packaging materials, the labor cost, manufacturing costs, sales revenue of past 5 years, etc. So these are some of the things required on that form. Okay, so basically on Form 5, this is going to reflect the prices in the four reference countries. And in Japan, they use USA, England, Germany, and France as the reference countries. And so this would be the form for that. So on Form 6, basically, you're talking about the comparison study about the impact of medical expenditures with the current technology. So the estimate here should match the Japanese medical system, which, as I mentioned, is different from the overseas situation, such as the hospital stays in Japan are so much higher than they would be in the U.S. So these are just some more some forms here, which you can look at more closely at your leisure. But the fact of the matter is, for C1, C2 products, there's more forms required, more detailed scientific evidence is required. But again, you're trying to go for the high-end reimbursement there. And again, for the C1, C2 listings, it's going to take a lot more time than if you're doing reimbursement category A and B for Me Too or commodity products. So these are the required documents for C1 and C2 listings. And I think they're fairly self-explanatory. And on the next slide here, we go through the process for the reimbursement for the C1 and C2 categories, just as we had gone through the reimbursement process for A1, and B products earlier in the presentation. But of course, the C1 and C2 products are going to go through more levels. You can see on the left side here that the request for the reimbursement listing, till they decide the category, could be 4 to 5 months. And it's not unusual, let's say, for C1 and C2 reimbursement levels to be determined, 1 to 2 years after you submit your information, although in theory it should only be 6 months. But we've seen some products that are a little unusual go longer. So here you can see the process, the expert panel meeting, they agree or disagree with the applicant, and then they inform the decision to CHIKYU, which, as I mentioned, is the main player for reimbursement. And this flowchart then is continued on the next slide. So this obviously is a lot longer path if you go on A or B. category reimbursement. So then the GQ basically is going to give you, the pricing. And as I mentioned before, there's 4 times when you can get the new reimbursement listing. And if your product is not going to be reimbursed in categories 1 or C1 or C2, then as I mentioned, there are a few products that go into category F. None of the products in category F I've worked on, but that's what would happen if your reimbursement category is not C1 or C2. Now, on this chart, basically, so here we have the classification of the device and what kind of reimbursement application you're going to be sending in. So obviously for product notifications, class 1 devices, we're looking at the A1 reimbursement category. As I mentioned, it could be only 20 days. These are a very simple product. For products that are class 2 products in Japan are categorized as either NINSHO, which can be approved by a notified body, or can be classified as MHLW class 2 products. So the class 2 devices, the classification of the device, the registration process, class 2 can be divided into the NINSHO, which is certified by the notified body, or class 2 products can also be put into the MHLW category, which will require MHLW approval, not approval from the notified body. So if your product is a NINSHO, that's NINSHO, you're going to go for categories A, 2, and B, and you can see the timing to get that on board. And then on the right side there, and in yellow, if your class 2 product needs to go to the MHLW as opposed to the notified body, then you can see the categories here for classified products, some 2 products, 3 and 4 device products, and the procedures there below in yellow. Okay, so we're going to go here to category F. As I said, I haven't had any experience with category F in Japan, but obviously it's an extremely innovative product. The risk may be rather high compared to the clinical benefit. And what I've heard, I haven't done these on my own, is it's very difficult or almost impossible to get approval for reimbursement code F. Now, actually, I want to go one slide ahead now first, and then we'll go back to the past slide. So now I'm on slide 54. And the point here of this chart is to show you that that each party, the distributor, the medical facility, the distributor and the medical facility are the ones that are going to negotiate the price of the medical device to the hospital. So basically, as you know, the reimbursement price is defined as the amount that is paid by the insurer, the government healthcare program. There's no Prudential travelers in Japan. So it's the reimbursement price is the amount that's paid by the government to the medical facility, which is going to be fixed. But the price of the reimbursement does not control the price situation between the medical facility and the distributor, or a distributor and an importer. So again, the reimbursement price that the hospital gets for the procedure, the product, whatever, under any of the ABC categories we've discussed today, is the amount that the Japanese government is going to pay the medical facility. And but keep in mind that that this price does not control the price between the medical facility and the distributor as the facility is buying the product versus what they're being reimbursed by the government. Of course, you have the reimbursement price are sometimes proposed by an importer to the MHLW, and sometimes these prices can be authorized by GQ too. So the main thing here is the distributor and importer on the right side of the chart. They're dealing freely with one another under the distributor law, and the insured person in the medical facility, and the reimbursement on the left side under the Health Insurance Act. I'm sorry, so I want to go back to the previous slide here. And so we're on slide 50, let's see here, 52. Just one second. Actually, on slide 53. Okay, so basically then, besides the information we presented today in the webcast, there are two main ways that the Japanese government reduces the reimbursement for devices in Japan. So there are two main ways. So the first way is through what they call the R zone. And the second way is what they look at is the foreign reference pricing. So again, the main way that the Japanese government reduces the reimbursements every couple of years is through the R zone or the foreign reference pricing. So we're going to turn first to the R zone. And so this is the difference between the actual purchasing price and the reimbursement price. And the reimbursement price obviously is fixed and controlled by the government. So what happens here is the MHLW allows only a reasonable zone or reasonable markup from their survey data. And for example, let's say the actual medical price is approximately like 11.4% less than that of the, let's say 11% less than the reimbursement price. So again, in 2005, the device that I'm talking about now, actual medical device price to the hospital was 11% less than the reimbursement amount. So the hospital is making 11%, or in theory, sort of like 11% on those products or procedures. Now, a couple of years later, in 2008, the government changed the reasonable zone, or the R zone, from 11% down to 4%. So in this situation, the medical device price is only about 4% less than the reimbursement price. So as the R zone goes down, the absolute reimbursement price will also go down. And we can look on the next slide to see a little more clearly how this works. So if we turn to slide 5, I put an example here of how this R zone works. And this is really a key, one of the two key fees on reducing the reimbursement prices in Japan. So here we have an example, medical device widget XYZ, and they have a current reimbursement price of $2,500 in Japan. Now, the Japanese government does an average selling price survey, and they find that the average selling price is around $2,000. So to get to the final R zone pricing, you need to add the consumption tax, which is like 5%, and so 5% is $100 of the $2,000. And then basically, this example shows that in 2008, the R zone was 4%. So, and then as opposed to 2005, where, as I mentioned, the R zone was like 11.5%. So if the R zone is only 4%, then on the reimbursement calculation, you would just take 4% of the $2,000 amount, and then if the R zone was 11.5%, like it was a few years earlier, 11.5% on $2,000 would give you $220. So the new reimbursement price of the medical device on this R zone example of a 4% R zone is $2,180. But obviously, the new reimbursement price of $2,180 is less than the original price of the $2,500 that we started out with. So basically, what you can see here is if you did the 220, so the bottom line is that so the additional amount added to the pricing with the lower R zone of 4% only adds $80 to the final reimbursement pricing. Whereas a few years earlier, the R zone in Japan was 11.5%, which would have added $220 in this column as opposed to $80 that comes from the 4% R zone pricing. So at the $220 level, then you would have had the reimbursement at $220 more than 2001-80, which would give you $2,300. So, for example, this device in 2005 was getting reimbursed at $2,300. That's basically $2,100, and instead of 80, the R zone was 11.5% 2000. We add 220 there, and then we get to the old reimbursement, which was $2,300. And then with a reduced R zone of 4%, instead of adding 220, we're adding only 80, and the reimbursement now is $2,180. So basically what's happened is that over the 3 years that this example is, the R zone was reduced, and the pricing of the product in the market went from $2,300 to $2,180, $2,180. I think that's right. Yeah, so that's basically how it works. I mean, instead of the 80 there for the R zone, you'd put the 220 in. If you added 2,100, 2,100, and 200, okay, so it'd be it'd be $2,320 would be the old reimbursement, and the new reimbursement would be $2,180. So again, to get to the $2,320, we're taking the 2,000, the 100, 11.5% of the 2,000, which is 220, and you get $2,320. To get to the revised reimbursement, which is down to 4% R zone, you only add 80, and you get $2,180. So the Japanese government over time has been reducing the R zone, which has been reducing the price of devices in the Japanese market. Now, the second main way that the Japanese government has reduced pricing is through this FRP, or Foreign Average Reference Pricing. And this system is revised every 2 years. And basically the government wants to control the medical expenditures. The purpose of the revision of the reimbursement also is to improve the efficacy and the quality of the medical treatment or care, and also, I'd say, to develop assessment systems for medical treatment and care. So here we have on the bottom there, on the second bullet point, the process price revision using the FRP. So basically what happens, the Japanese government looks at a sampling model. They survey distributors around the country, medical facilities, dental clinics, or whatever. And they do this survey over a 4-month period. Normally it's from May to September of the year. And then they look at the pricing that the government's got of the product on the Japanese market, and then they compare the price on the Japanese market to what the prices are for the same product in the U.S., England, Germany, and France. So again, basically what happens is the MHLW does a sampling method, surveys the market for the reimbursement pricing of the product in Japan. Then they compare this number to the 4 foreign countries and what the average pricing of the same product is, and that's how they look at the foreign reference pricing. So what happens here, so the rules that came up a couple of years ago actually were that for new products that are being registered and reimbursed in Japan, if the reimbursement price in Japan is more than times the foreign reference price, the Japanese product price would need to be reduced to 2 times our FRP. So in other words, if the product is selling reimbursed overseas at $1 and it's being reimbursed in Japan at $2.5, this FRP would allow you to reduce the product to $2 from the $2.5 in Japan. So that's one way the Japanese government can reduce the overpriced or over-reimbursed products in Japan to more international standards. So then also on the second bullet point, the same analogy. Let's say the foreign reimbursement's $1 and the Japanese reimbursement is $1.75. So if the Japanese reimbursement price is greater than 1.5, the FRP price and 1.75 is higher than 1.5, the reimbursement price is reduced again by a set schedule and a set formula. So that's the other way they look at things there. If the price is more than 2, is less than 2, but more than 1.5. So keep in mind that 10, 15 years ago, basically, medical device companies in the States could sell their products in Japan, and the reimbursements were so high that if the device company had $1 billion in sales and 10%, $100 million of the sales were in Japan, because of the high reimbursements, they could have gotten, instead of 10%, they have 10% of their sales in Japan, but they may have gotten 20% of the profit of the company from the $100 million in sales in Japan because of the high reimbursements in Japan. So this FRP is an attempt to lower the prices again. So when device companies now sell, let's say, $1 billion, they sell $100 million in Japan, instead of getting maybe 20% of their profitability of the overall company from their Japan sales, they might only get 15% or 12% of the profitability for the company with the 10% that's being sold in Japan. So on the next slide here, we have in March 2006, so this is about 4 years ago, reduction of medical devices and drugs. There were some reimbursement cuts that went in effect, similar to 2010 now, and it resulted in average reduction in reimbursements about 2% for medical devices. And you may recall then when that FRP was put in place in 2006, the orthopedic device industry was subject to significantly higher reimbursement cuts than the average cuts on other medical device products. And in the orthopedic area, the hip implant segment experienced, let's say, a cut of about 13%. Knee implants were about 7%. Trauma devices experienced cuts of about 13%. So, and the spine segment experienced less reimbursement reduction, but overall, the orthopedic device industry had bigger cuts than other devices in Japan. So a lot of orthopedic companies were upset about that. And then again in 2008, there were more medical device cuts in medical device pricing with the FRP. And the main point is that both of these systems, as I mentioned, have reduced the prices in Japan, whether it's the foreign reference pricing, which we just went over, or the R zone, which was the other main factor in price reduction. So then a lot of times companies in the States will be given these price reductions. Why should we come up with innovative products for Japan? And that's always an issue. But keep in mind, as far as product registration goes, the Japanese government has now been allowing some products to get fast-tracked from smaller or mid-sized companies because they realize they're missing out on important technology. So the next slide here, as I mentioned, the old days pricing was so attractive in Japan. Japan reimbursement pricing is now still decent, but it's not outrageous. We expect continued pressure on prices as the years come by. Obviously, the regulatory burdens on the product registration and getting the right reimbursement category are difficult. But as I mentioned before, small to mid-sized companies we've seen with unique technology are now getting more fast-track approval times and also reimbursement times. So that's going to conclude my formal presentation today on Japan medical device reimbursement. I hope the information was helpful to people. At the end of the session, we are going to send you an evaluation form. We would appreciate your feedback. Also, if you could indicate other webcasts that you might be interested in the future so we can try to accommodate needs. So those evaluations will be going out in about 40 minutes. And this will be now, we're going to start the question and answer period. I'd like to get a drink of water, and then we'll start with the first question. So if you have a question, please submit it online now. So we have quite a few questions here, and so the first one is, what is the best way to get a preliminary read on product reimbursement? Can this be done in a new consultative session? What is the best way I'm going to repeat the questions twice. What is the best way to get a preliminary read on product reimbursement? Can, I guess, the preliminary read on product product reimbursement be done in a consultative session? Well, the consultative sessions of the last few years, Japan government has put in consultation sessions for clinical trials and other things. So you might be able to discuss reimbursement at one of these consultative sessions. And normally, if you get a response at the consultative session, it's more bankable than it used to be. So some companies have elected to do that. But in general, excuse me, I would say that the applicant should, review the guidance preparing these documents and study the definition of the functional categories to see if a match can be found, and then based on the marketing strategy beforehand. Then, if you want to do a pre-consultation session with the MHLW, you basically have to put together a fairly complete dossier, submit to them in Japanese, and then the MHLW will review your draft dossier, and then you'll be able to meet with the MHL officers during this consultative session. Keep in mind that meetings between the MHLW and the experts are closed, and there's no way to attend those. And keep in mind also that these new consultative sessions, while they may give you more feedback, more accurate feedback, and sometimes feedback you can take to the bank, the consultative sessions are not cheap. So they can range anywhere from $10,000 to $40,000, depending on the nature of the consultative session. So you can get some preliminary read by going through the consultative sessions, but again, you have to have about 2/3 of the dossier done, completed into Japanese, and there's a fairly large fee for doing that. Can you comment on the most recent device reductions announced several months ago? So I guess it would be for 2010. Can you comment on the most recent device reductions announced several months ago? 1 second, please. 1 second, please. Okay, I'm sorry. So can you comment on the most recent device reductions announced several months ago? Well, of course, the reductions depend on the product. And I think out of the 700 or so functional category products, somewhere like 500 were reduced in price reductions, reimbursement, whereas I think there were 10 or so that were increased on the reimbursement. But again, out of 710 functional categories, 500 or so were reduced in reimbursement. I think also about 100 products had no change in reimbursement, and so that's how I see it. So then the other products would be somewhere in between. A few products were reduced less than 4%, and some were reduced by 25% in the past year. Next question. If you do not agree with the reimbursement and you challenge the MHLW and they still refuse to change your reimbursement, what else can you do? So again, if you do not agree with the reimbursement and you challenge the MHLW and they still refuse to change your reimbursement, what else can you do? Well, obviously, you have the right to refuse the MHLW reimbursement, especially when it changes your proposed category, let's say from Category B to Category A. And you can also go before the MHLW and the experts, emphasizing the value of your product in the specific category originally proposed. I'd say in general, the MHLW and the experts are rarely going to change their mind, but you do have the right to refuse the reimbursement set by the MHLW. Okay, next question. How many C1 and C2 approvals have been granted? How many C1 and C2 approvals have been granted? Well, I guess the last time I checked, maybe there were 25 C1 products, maybe 35 C2 products. So I don't know if there's any official statistics, but there have been a lot more C1 and C2 products reimbursed over the last couple of years. Next question, how much extra time will it take to get your product reimbursement approval if you go from reimbursement category B to category C? How much more time will it take to get your product reimbursement approval if your product goes from category B reimbursement to category C reimbursement? So, I mean, the basic thought is that if you switch from a category B reimbursement to a category C reimbursement, you're going to have to restart the process from the beginning as far as the whole reimbursement process. And then, it's going to, again, take around 4 months or so to decide the category, and then, additional months to follow the process of category C products. So, again, the time frame for the reimbursement from go to B to C can be fairly lengthy. Okay, the next question. Does the information used during the consultative sessions need to be in Japanese? Must all documents be submitted in Japanese? Does the information used during the consultative sessions need to be in Japanese? Must all documents be submitted in Japanese? Well, the answer to that question would be yes. The Japanese is the only language issued for public purposes in Japan, so any consultative session information has to be in Japanese. Next question. Who established the diagnosis procedure combination? Surgeon groups or MHLW? Who established the diagnosis procedure combination? Well, I think it's the MHLW that set up the diagnosis procedure combinations in Japan, and this closely follows the U.S. DRG system. Okay. A question about one of the slides on the forms to fill in. So is the list of devices requiring facility criteria complete? This is on slide 21. Is the list of devices requiring facility criteria on slide 21 complete? So the answer to that would be yes. Next question. What does it mean that reimbursement for C1 and C2 are reimbursed 4 times per year to the provider? What does it mean that reimbursement for C1 and C2 are reimbursed 4 times per year to the provider? Please confirm that the reimbursement schedules for products category to C2 will take place 4 times per year. Yes, so as I mentioned during the presentation, the answer would be yes. Assuming that the applicant accepts the provisional price, the reimbursement will take place 4 times a year. Okay, the next question. On page 39, you state that we will present to an expert. Who is this expert? Are they going to be directly related to our specific field, or it will be an expert from a generic medical background? So again, on page 39, you stated that we will present to an expert. Who is the expert? Are they going to directly be related to our specific field, or just more general medical background? Well, I think that the panel's makeup is generally generic doctors, not industry specialists. And it normally also includes an economic expert. But I think this may be changing where more experts in specific fields are added. But I'd say the answer to the question is, in the past, in general, the doctors on the panel are more general, not specific to the industry, but it's changing. Okay, next question, number 12. Is the way in which a product is filed for approval tied to reimbursement? Is the way in which a product is filed for approval tied to reimbursement? We have had a case of a product that required a STED type submission, but we advised that if the STED were presented as a Me Too type of device, there was no way to get a higher reimbursement for the device. We were told that we would have to still file a STED, but under an improved type format, which risks needing clinical trials in order to obtain a higher reimbursement price. Can you please comment? Sort of a complicated question, but let's see. Is the way in which a product is filed for approval tied to reimbursement? Is the way in which a product is filed for approval tied to reimbursement? Well, I'd say they are sort of tied to reimbursement because and that the product approval and the reimbursement are somewhat connected. Because when you did the product registration, the device was put into a functional category, and it had to be priced similarly to common members of the category. So I'd say that the two are related somewhat. Question number 13. Will the MHLW foreign reference pricing be limited to the 4 countries mentioned in the presentation, or will other countries in Asia be included in the future? Will the MHLW foreign reference pricing be limited to the 4 countries in the presentation today? Well, I think there was some kind of tentative use of some pricing in some Asian countries for foreign reference pricing in the past, but I think the MHLW now has returned to just focusing on these four countries for reference pricing, foreign reference pricing. Next question, can a foreign company apply for reimbursement by themselves, or do we need a consultant expert group to support us in negotiation with the MHLW? So can a foreign company, I assume this means a foreign company without an office in Japan, they're just exporting their device to Japan, apply for reimbursement by themselves, or do we need to have an expert group to support us in our negotiations in Japan? Well, I think the answer would be that the foreign company, can be assisted by a consulting group in Japan, but it's only the applicant who's actually allowed to try to negotiate with the government. So I think that's the answer there. Question 15, what role does clinical evidence play in the reimbursement process? Is it only involved in registration? What role does clinical evidence play in the reimbursement process? Is it only involved in the registration? Well, what I'd say there is that in cases when the product is particularly new in both performance and function, but let's say clinical trials may show a higher rate of adverse events, then the results of the clinical test may influence the reimbursement decision. So if it's a new product, function, and performance, and the clinical device shows a higher rate of adverse events, then the results of the clinical tests may influence the reimbursement decision. Okay, next question. Is a reduction in surgery time considered a clinical benefit that could be addressed by C1? Is a reduction in the surgery time, I guess it's more efficient, considered a clinical benefit that could be addressed in C1? Well, I'd say here that if the patient recovery time or the hospitalization time is reduced, then I think this would be a consideration for the surgery to be more efficient, and could be something that you would bring into Category 1 for product reimbursement. Another person that asked these forms have to be complete in Japanese. I mentioned that they do. And let's see, in the case where products, another question here is, in the case where product can be reimbursed, where they have to work together to prove a functional clinical benefit, this is, for example, products that wear against each other and we're trying to prove reduced wear, and this benefit cannot be assigned to individual components, what is your recommendation for proceeding with a C1 request? Wow, let's see. In the case where products to be reimbursed have to work together to prove a functional clinical benefit, for example, products that wear against each other and we're trying to prove reduced wear, and this benefit cannot be assigned to individual components, what is your recommendation proceeding with a C1 request? Well, I don't know the answer to this question, but I guess I'm not sure we're talking about a combination product here. I guess that would be more drug, IVD, device, whatever. Two products that wearing against each other that reduce the wear. I would say that's unsure whether that would help you get into the C1 class reimbursement classification. I'm not sure on that answer. Next question, where can we get a listing of all existing medical device categories codes in English? Where can we get a listing of all existing medical device categories codes in English? Well, to my knowledge, I think the list is only published in Japanese, so I don't know of any listing of the codes in English. Should foreign companies, I guess, that don't have their own office in Japan, use a local Japanese company specialized in reimbursement application? Well, yeah, I think I'd always recommend that if you don't have your own office in Japan, that you use a consulting company to help you with reimbursement issues. But keep in mind that you're going to have to submit the application on your own. Next question, can one bring a renowned Japanese expert to the consultative session? Can one bring a renowned Japanese expert to the consultative session? Well, I'd say you could probably bring a Japanese expert, but I'm not really sure if that's going to be helpful during the consultative process. Next question. In respect to page 39, how can someone with a dentist background answer questions on a pacemaker? What is the rationale for not having an expert from the designated field? So again, then on page 39, how can someone with a dentist background answer questions on a pacemaker? What is the rationale for not having an expert from the designated field? Well, I think that's a good question. I don't think a dentist can really make any comments about pacemakers, but in general, the experts are more generalist-type doctors. They have a wide range of knowledge. But in general, I'd say that this kind of expert doesn't have that much rationale. But unfortunately, in Japan, this is how the system is set up. And normally what happens is the applicant for the reimbursement needs to bring the experts up to date on the product, the technology, and the sector, et cetera, if, to make them more knowledgeable. Okay, a few more questions here. The import approval of a new medical device is severely delayed now. The import approval of a new medical device is severely delayed now. Are there similar delays in the approval process for reimbursement? So I guess basically the question is, if you want to export your product from the West to Japan, you need to get a product registration. And the person sending the question in is saying that the process is slow. Well, I mean, there have been a lot of steps by the MHLW, PMDA, to raise the number of reviewers, set up a fast-track approval. But I'd say, obviously, more complicated product device registration in Japan is fairly slow. And then, are the same delays in the approval process for reimbursement? I'd say no for A and B reimbursement categories. But for C1 and C2, there can be significant delays in the process of reimbursement in Japan today. And again, keep in mind that reimbursement delays can also be, a function of the registration delays. Because again, the products in Japan must be approved for registration or shonin or ninsho in Japan before they can apply for the reimbursement. It says here, must all indications for use be submitted at once or can they be added later? Must all indications for use be submitted at once or can they be added later? Well, the answer to that question would be yes, it is possible to add indications later, but obviously those other indications are going to require product approval. Okay. So we have another question here. Reference marks are a bit surprising. Germany has some of the lowest prices in the world, while Japan has among the highest. How does the MHLW justify their choice of reference markets, and why not act in not in the APAC or I think another Asian market? So I don't know why Japan picks these four countries. That's what they decided to use, and That's how they look at the foreign reference pricing. I don't know if I have any other thoughts on that, but that's just what's used. Okay, next question. Let's see here. Have any products applied for F listing in the past? Have any products applied for F listing in the past? Well, as I mentioned in the presentation, we haven't worked on any F products, but I do know there's one or two that applied for F1 listings. I don't know what happened. I think one of those products was the artificial heart that went into the F reimbursement category, but I don't know what happened with that. What do non-A2, non-B, etc. mean? What do non-A2, non-B, etc. mean? Oh, so this is probably in the flow chart. So what non-A2 means is it's not approved for A2, or non-B means it's not approved for B reimbursement classification. I think that was in the flow chart on the registration process. Is it helpful to have an American or European company, accompany or Japanese people in Japan or a distributor in Japan for discussing reimbursement issues with Chikyu? Is it helpful to bring, let's say, an American or European company representative to Japan to work with your Japanese distributor or your Japanese office or Japanese MAH to discuss reimbursing pricing with Chikyu? Well, I would say that it's normally, I wouldn't say helpful. I mean, normally what you want to do is have your Japanese people do the negotiations on your behalf for the reimbursement in Japan, and sending over foreigners to beat up on these reimbursement panels, et cetera, is not going to help you that much. Next question, what advice do you have for companies who feel the reimbursement process not being done quickly enough or in the proper manner? What advice do you have for companies who feel the reimbursement process is not being done quickly enough or in the proper manner? Well, there's a lot of companies complaining about the reimbursement prices and the process. So I guess normally what I'd recommend is that you might want to try to contact the economic division in the MHLW. And there you can, I think, in the economic division have some give and take on what your issues are. Okay, a couple more questions here. Is there any condition under which reimbursement prices increase during any given period? Is there any condition under which reimbursement prices can increase during any given period? I'd say that it's very difficult to change the reimbursements once they're set. However, if your device has a whole bunch of new features and this and that, I guess you could apply for a high reimbursement code, but I wouldn't say there are any guarantees on getting it changed. So next question, where do you find information on the functional categories? I think we answered that. Next question, what are the specific requirements to qualify as an importer? What are the specific requirements? So I guess basically you're asking if you're exporting your products, your medical devices to Japan, what are the requirements for the importer? Where there's some set regulations for the importer, but I think the main thing is that the importer is going to act as your MAH license holder, market authorization license holder. So again, the MAH can be your own branch subsidiary office in Japan, your distributor in Japan, partner in Japan, or it can be an independent third party. As mentioned, we're offering this MAH service at Pacific Ridge Medical now. Okay, so I think that covers most of the questions out here. We got a couple more, so let me take a look. Is the price to a medical facility from a distributor typically similar to the reimbursement set by the MHLW Chikyu? Is the price to a medical facility from a distributor typically similar to the reimbursement set by MHLW or Chikyu? Well, I think the main point here is that if the cost of the product, the hospital, is significantly less than the reimbursement price, I would assume that the MHLW Chikyu will look at that product for further evaluation. So again, we talked about the R zone, 4%, the hospital bot getting reimbursed at 100, the distributor selling the product to the hospital at 94. So that R zone is probably appropriate today, or 96, I guess it would be. But if the hospital is getting reimbursed at 100 and the distributor selling to you at 80, I think you'll then be subject to evaluation by CHIKIO in more detail. Next question here. Clarify that the importer has to apply for reimbursement. Does this mean the U.S.-based company or its JPN distributor? Well, basically, to apply for reimbursement, you have to be the shonen holder, whether that's your own office in Japan, your distributor, independent third party, etc. Okay, here's the next question. C1 and C2 require information that's not part of the regulatory submission. To what extent is additional information tolerated in the reimbursement submission process? Well, I think additional information that's scientific or shows economic benefit is definitely allowed in the reimbursement process. The main thing is to make the arguments concise and fairly straight to the point, so Japanese reviewers who have different levels of English aren't going to be confused by additional information. Okay, so I think that's pretty much the questions we have. We're at about 12:27, I guess, on the clock. So thanks again for listening to our webcast today. We hope you found it informative. Please sign up for upcoming webcasts that we're going to have on China in January. And again, please fill out the evaluation forms as we send them out. Again, this is Ames Gross from Pacific Ridge Medical. Thanks for attending. We appreciate your business, and have a nice day. Goodbye.